Wherever you are.
Oh, wait, so we're actually getting in the shower.
Oh, we're already live.
Oh.
Hi, everybody. We're live. And by the title, you see that it's probably not actually going to be the clean version. Who knows what kind of questions will come from this? And you guys saw from the thumbnail that, well, as you can see, we're not alone. There's like shoulders back there behind the shower curtain. Hi, Lisa. Are you and your friends here?
Hi.
Nobody has given us their greetings yet, but yes, they are all here, and they have questions for the doctor. So you and they can have questions together. Should we introduce ourselves?
Sure.
Okay, I'm Dr. Mark Vaughan, a medical doctor, and we have.
Hi, I'm Lisa. I'm Dr. Vaughan's daughter.
That's you, Maggie.
Hi, I'm Maggie. I'm Lisa's friend.
I'm Dina. I'm Lisa's friend.
And Grace.
I'm Grace, another friend. I'm Emily, another friend.
I'm Katie.
Okay, so now that we have everybody introduced, I'm also going to be talking to them because they're also here too. So we have Norma Jean Green saying, "Good evening, doctor." BooBoo Kitty is here. Okay. Haha, the clean version. Lindsay Antwine, hi. And Claire and Barney Dog, hi, I'm here. Jenny Lockhart's here. So that's all here. So while they're arriving and they're greeting us, you guys can start with your first question.
How much vaginal discharge is too much?
Lisa from Auburn asks, how much vaginal discharge is, what did you say, too much?
Too much.
It varies from person to person. Of course, the normal secretions, some people have more, some people have none. So some would say any is too much. Others would say when you have to change more than twice a day, that's too much. Okay, Petra says, good morning from Sweden. And Petra, I am so sorry about the news this week. We are praying for you. And do you want me to go ahead and let people know about what's going on? If so, let me know, and I'll fill them in, or you can. They're all in the shower. Mary Frances, hi, Doc. Jonah Finlinson, hello, guys. Aaron Beck, hi. Petra already said good morning from Sweden. Kimberly Vaughan, hello from another. Is that our Kimberly Vaughan? Is that? I can't tell.
Are you related to us, Kimberly Vaughan?
Is that Kimberly who I just saw like an hour ago? She was at the wedding.
Oh.
Lindsay says girl and discharge is good. A dry vag is no fun. That's from Lindsay Antwine. And yes, you do not want to have too little secretions, which becomes a problem with hormonal changes after menopause. And so sometimes we'll actually use medications to help with that. We try to avoid hormones because there's risks that come with that. Petra says yes, you can tell. Okay. On a serious note, Petra was found to have lymphoma, and I'm trying to remember what else you had said because they were operating on you. But that's kind of the biggest thing, and so everybody remember Petra. Okay, so Kimberly Vaughan says, no, it's not our Kimberly Vaughan, it's a different Kimberly Vaughan, maybe related. BooBoo Kitty, hi Lisa, you need to do a freshman vlog. She's talking about when you go to college.
Oh.
She wants to follow your vlog.
Yes.
Okay.
Yes.
Yeah, and hit her up for Patreon too.
Yeah, BooBoo, how much you want to pay me? BooBoo? Do you want to give me a scholarship to college so my parents don't have to pay so much? Just let me know.
The Patreon scholarship.
No shame.
So we'll leave that between you and BooBoo. Debbie Ronker, hey Doc, I'm with you. And okay, Cheryl McNutt, hi there, Doctor. Sharon Calvert, good evening. And of course, Claire, my prayers are with you, Petra. Kathy Cruz, hello from Texas. We have somebody from Texas also. So somebody from New York, somebody from Texas. The shower is very excited about Texas. How's it go? Deep in the heart of Texas. Thank you, everybody. See, they know. We're in California, we even know. BooBoo. Lolo, people call me mine. Have your people call mine. Okay, we'll work that out offline. Mary Wagner, hello from Jacksonville, Florida.
What?
Hello from Philly.
Whoa.
North Tabitha Buncourt from North Carolina. Tammy Mills.
Carolina person?
Oh yeah.
Did you know that there's a Harry Styles song written about Carolina?
That's right. Sing the chorus.
She's got a family in Carolina. Grandma told her town. Just send me for your trout.
Yeah, I was gonna say there's another part. Okay,
No, it's Harry Styles.
what's that? She's having a baby. It's none of my business.
Oh yeah, that's cute.
Is that the same song?
Same
No,
clothes,
same
same person, different
Same album anyway. We've got some comments here. I'm sorry I'm not keeping up with them, guys, but man, we are getting really popular on the internet. 31 right now, and lots of thumbs up. Ryan from Kansas. There's a guy out there, ladies.
How old are you? Are you single? How old are you? We're all single.
Okay. Okay, the prestige of the medical channel just took a leap in another direction. Run Crash Pop says, what in the world's going on in that shower? Kimberly Vaughn, loved living in Texas, now in Michigan. Tabitha Bancord has a smiley face. Stephanie O'Brien, hello from Michigan. Run Crash Pop, Arizona checking in.
Wow, hi.
TR, well, it's the weekend, so I'm at my storehouse. So hello from Philly and Jersey Shore.
Wow.
I don't think they're actually in Philly and Jersey Shore. I think somebody's name is Philly and somebody's name is Jersey Shore. I'm not sure.
I was gonna name my kid Jersey.
I know. Lindsay Bailey, I joined too late. What's going on? LOL. That would be lots of love.
Oh yeah. Lots of love back.
Tabitha, what part of North Carolina are you from? I'm on Jacksonville. Or, as some of us know who watch, what is it we watch? Terry Bull.
Terrible.
Terrible.
What? Has anybody seen the Terry Bull where he goes to the town and the town's name is,
Yeah,
what's the town's name?
I don't remember.
What's the name of the, somebody tell me what the name of the town is on that Terry Bull video. It's actually Jacksonville, but he reads the sign differently. Oh, wait. Mary Francis just gave us a $2 pledge, a super chat.
Oh.
So, Mary, since you did the super chat, you get special treatment here. Your daughter and friends are lovely. We're going to read every word of your comment. Your daughter and friends are lovely. And respond to it. Thank you. And daughter and friends. Thank you for the $2, Mary Francis. Way to set an example for the rest of the people participating here. It's Omar 7. What's going on? TR, I live in Philadelphia, but we go down the shore on weekends to our shore house. Okay, so maybe it actually was Philly and Jersey Shore. Hi, Rosemary from UK. So we've got somebody from UK. We got somebody from Sweden.
Do they know Harry Styles?
Do you guys know Harry Styles? Petra Rosenberg, Hodgkin's lymphoma and 2 cancer tumors besides my belly button. That's right, that's what it was. Surgery on the tumors this Tuesday and then start with chemo 4th of July. Now, in addition to praying for Petra and being serious for a moment for her, it's a chance for those of us who didn't just get this news this week to realize how good we have it. And we need to be, at the same time, being grateful. Also, remember Petra. Okay, Lindsay, leaving North Carolina. That's right. Okay, as you leave the city limits, there's actually a sign that says leaving city limits. And so he thought he was in the town of Leaving.
Oh.
Because it says leaving city limits. So that's Lindsay Antwine from Leaving, North Carolina.
Terrible.
Jenny Lockhart from West Virginia. Christy Sipes, howdy from hot Modesto.
Why do you live there?
Let's not alienate the participants here. Sharon Petra Hearts. B. Mel, hello from Pakistan?
Whoa.
Wow, I think you get the prize for the most exotic location tonight. Pakistan.
Well, how about Packet Paul, not Packet Stan? Let's not leave Stan, single him out. Packet Tim.
Packet Paul.
Packet Paul.
Not
Packet
just Stan,
Paul,
but Paul too.
Packet Stan.
Run Crash Pop. Just fought BAL leukemia and had BMT, bone marrow transplant here. Keep fighting, Petra. Yes. BooBoo Kitty. Wasn't it leaving? Yes, BooBoo. It was leaving city limits.
Question?
Oh, let me get through these 3 and we'll do it. Lindsay Bailey's from Kentucky. Mary Francis. You deserve it, Doc. I'm in South Carolina. Rusha Muskie says something I'm probably going to put them in timeout for. BooBoo Kitty. Petra's my hero. Jason Parrish in Louisiana. Prayers to Petra from TR. Born and raised here in Modesto. And BooBoo Kitty also noticed that Russia needed to be put in timeout. Okay, I'm sorry. What was your question?
Oh, I have one.
Yeah.
Okay, what characteristics define like astigmatism in your eye? Like, what is it exactly?
Astigmatism. What is astigmatism? It's an ophthalmologic or an eye issue. Let me see if I can change this a little bit. Astigmatism is where the eye has an irregularity in the shape of it, and so you can get distortions in vision that are different from just plain near vision or far vision or near vision. What's the other one? Near vision or far sight. Thank you, far sight. That's an issue of a distance where the light going through the eye, which is a round lens essentially.
Yeah.
It's focusing either in front of or behind the retina, whether you're near or farsighted, so things are in front of or closer or further away, they're easier to focus. But astigmatism, there's actually an error, a funny bump-like or a distortion of some sort on part of it. So that has to be fixed a little differently, so the lenses have to be kind of custom-made for that. Lindsay Bailey is jealous of Cheryl McNutt. Oh, let's see why. Because Cheryl McNutt says, I'm probably from the coldest Nova Scotia, Canada. I think it's probably Nova Scotia, Canada. So somebody from Nova Scotia too.
Wow.
Did I answer your question?
Yeah.
Okay. Okay, so that was from Grace. I'll call you Grace instead of Gracie. Is that
Yeah, either way.
okay? Either one. Okay. Lindsay Bailey jealous of Cheryl McNutt. Crystal M shaped like a football. LOL. They're talking about the lens, not what we were talking about before we started this. Petra Rosenberg, thanks Claire, to Sharon, to Run Crash Pop BooBoo, and TR, thanks from Petra. Lindsay Antoine, I've read that using corticosteroid creams around the eyes can cause cataracts. True? True. Also, there's a small risk to using nasal corticosteroid sprays. Does anybody here use Flonase or Nasonex?
No, but I use this in my nose.
That's a good treatment for bloody noses.
Yeah. That's what you see in Channing Tatum in that one movie.
Channing Tatum had it.
She's the man.
I thought it was in the wrestling movie where Steve Carell. I'm not gonna give away what happens. No spoiler alerts here. He doesn't do that in the wrestling movie?
What's it called?
Fox.
Foxtrot or
Foxcatcher.
Oh, Foxcatcher.
Foxcatcher. He doesn't wear a tampon on his nose on that one?
I think he does.
You're right.
Yeah.
Wait, so
Good.
what happens with the Flonase though?
Yes. The nasal corticosteroids can put you at increased risk for cataracts, but it's very low, very low. Or Flovent, if you have asthma and you're taking this inhaled, the risk is very small. It's better to breathe than worry about cataracts later in life that can be treated. Okay, let's get caught up with your questions here. Boy, you guys are asking so many questions, it's hard for us to keep up. Okay, BooBoo says, aha, Peanut Gallery, those girls are great. Cheryl McNutt, hugs Petra and prayers. Yes, BooBoo Kitty loves Lisa, she's crying laughing. Emoticon, emoji. Mo McKeon, we use the tampons when wrestling, just shove them up our noses, LOL. Lots of love to you. Petra Rosenberg, love to you, Cheryl. Sharon Calvert has an emoji. I don't have good enough vision to read it, but it's not because of astigmatism, nor is it because of corticosteroids causing any kind of cataracts. BMA says LOL from Pakistan, or Packet Peter, or Packet Gun. Lindsay Antoine says, I'm amazed I don't have horrible cataracts then. I use all that. I know. That's why I'm trying to emphasize low risk, little risk. See on the screen how little that is? Oh, wait, that's taking up the whole screen. Oh, Gwen Vaughan, it's Dr. Gwen. Dr. Gwen.
Hey!
We missed you at the wedding, Lisa. Nobody had any sweet moves without you there.
Oh, I was dancing elsewhere.
She was dancing with sweet moves. So was, what's the name of that girl?
Sierra.
Yeah, well, absolutely, Sierra, but I mean the other one.
Maya.
Is that her name? Yeah, Maya, if you're watching. You were really cool. And of course, Sierra. Absolutely, Sierra's awesome. Jason Parrish, is it okay to use cayenne pepper powder on a cut to stop bleeding? Oh, gee. That sounds like a really mean thing to tell somebody to do. Crystal M, I came in late trying to figure out why everyone in the shower. The idea was that this was going to be clean, and it just didn't work out that way. Lindsay saying hi to Dr. Gwaine. Petra saying hi to Dr. Gwaine. Sharon Calvert saying hi to Dr. Gwaine. Mary Frances is just wow with a question mark. BooBoo, hi Dr. Gwaine. TR, not sure, but they're not in a closet. Yes, they all have come out of the closet and into the shower.
Yes.
Gwaine, yo. Ashton's on. Ashton was at the wedding. Ashton Fisher. But it's not Fisher anymore. Well, maybe it is. I don't know if she kept her last name or not, but now it's Vaughn.
You should have changed your last name to Kutcher.
Should have changed your last name to Kutcher instead of Vaughn. Hi, Ashton. So good to see you. And hey, share this with anybody who's around you, because I'm sure you're probably with a bunch of family, probably a bunch of in-laws, probably a bunch of brand new in-laws, I would guess. That purple, or that perp 1E, where are you guys from? We from Auburn. BooBoo Kitty, clean, haha, that went downhill fast, didn't it, Dr. Vaughn? Yeah, I know. Shelly Allen says, I love your videos. You have great bedside manner and awesome patience, and not such a bad showerside manner, I would think. Dr. Gwaine says, with me, oh, Ashton's with Gwaine. Okay, Ashton Fisher is sitting by Gwaine, and Jonah Finlinson is saying, hey, Dr. Gwaine. So Ashton, I would say Ashton's my newest niece, except we just came from a wedding where we got a new one. So now I have yet another new niece. The purple, I see. Okay, next question. Who's up?
What are the first signs of toxic shock syndrome?
Okay, a question from Dana. What are the first signs of toxic shock syndrome? Toxic shock syndrome is an infection, a really bad strep infection from a streptococcal bacteria, which there's lots of streptococcal bacteria. They're all over our skin, right? They're in our nose. They're everywhere right now. Right now on you, you have streptococcus on you. Which is not such a bad thing. It's been there all your life. It's been on humans all through human history. Even in the shower, people have streptococcus on them. So that's not a bad thing necessarily. It's just normal bacteria that live on our body. What's bad is when it gets inside of our bodies, through the skin, through an opening, and infection can spread. Now, this was a big problem with super absorbent tampons in the 80s. Do you guys know about this? Anyway, there were these super absorbent tampons, and people would just leave them in for long periods, and they would get really dry, and these cracks would occur in the mucosa, and bacteria, because strep bacteria oftentimes can be inside of the vagina, and that's one of the things we test for when people are going to have a baby. We check for group B strep, and we treat them if they have it. This bacteria, the strep bacteria, can cause horrible infection that gets in the blood. It makes you very, very sick. And causes you to go into shock, meaning that your heart is not able to supply enough circulation to your extremities. Maybe it's not so much the heart's problem so much as the blood vessels just relaxed to the point of just letting blood leak out of them, and don't have any tone to them, support blood pressure. So there's a drop in blood pressure, and people can die from this. So that's toxic shock syndrome. So early symptoms would be, if it was from a tampon, there would be pain and probably vaginal discharge. It can come from other infections though too. It can come from other mucous membranes. I guess if you put it into an open wound in your skin, it could happen there, and there'd be local redness and pain and swelling. Never seen it, so some of this is just a doctor's guess, which is, like, better than a dog catcher's guess. Not to insult dog catchers, this is the first thing I could come up with. Okay, so we came up back with Jenny Lockhart. Yeah, I can see your finger right into the whole space of the phone. She was talking about when I was showing you how little risk, just a little risk. Mary Frances, is your daughter going to be a doctor too?
Don't play me like that. I don't want to be a doctor.
You might get your PhD in something.
PhD in dancing.
Okay, yeah, Mary Frances confirms that it was toxic shock syndrome in the 80s. And how old are the girls? I'd probably get in trouble if I answered that for everybody. Let's just say most of them are over 18.
Yeah.
Yeah, most of them are over 18. Jenny Lockhart. Yeah, I can see her finger. Oh, we already did that. How old are the girls? LOL. Lots of love to you. Ouch. Cayenne pepper and an open wound. I'll remember this for my next unruly patient. Yikes. BooBoo Kitty. My dad used turpentine on his cuts. Mary Frances. Toxic shock syndrome in the 80s. BooBoo Kitty. Mary. Yeah, I was thinking that too. Petra Rosenberg. Does the shower girl has summer break now? Yes, this is summer break for them. Bit of its translation from Swedish to English. Mary Frances. Yep, BooBoo. Ethan Vaughn. Hello, father.
Oh, we like to call him Daddy.
Which they give me a hard time when I refer to my own father as Daddy, because I'm a 47-year-old man, but whatever. Jenny Lockhart. Why? Lindsay Antoine. Bah. Cheryl McNutt. Lol. Mary Frances. I don't know how to make that. Okay, Ashton Francis is saying, hey, Ethan, I just saw you. Because she did at the wedding. BooBoo Kitty is crying laughing with a heart. TR, lol, I have a son who's going to be a freshman in college in the fall, and I'm wondering if this is going to
Where's
be
he going?
the scene at Drexel in Philadelphia. Is that right? That's where.
Wait, yes, and this is Instagram.
where
Yeah, send us his Instagram.
Sh-
Tell us if he's single.
Send his Instagram. They'll check it out. Drexel is where Mr. Schroeder's daughter-in-law graduated from medical school. Mary Frances with the missionary remark. Oh, okay. Cheryl McNutt. Those look too business-oriented to enjoy missionary. You really took us down a bad path here, Lisa. Bailey Girl Smith. I missed the beginning. Why is everyone in the shower? TR. Yes, Philadelphia. Cool Boy Gaming 10. C. Nuts. Jenny Locker. OMG. The Purple. Do you know what causes seizures? Poorly behaving teenage girls in the shower? Does that cause seizures? Seizures are a discharge of electrical activity in a part of the brain that spreads. Sometimes it doesn't spread, it just stays in one place. You can have generalized seizures where you're unconscious with convulsions. You can have partial seizures where a part of the body is convulsing. You can have a seizure without even having convulsions. You can just have loss of attention. You can have fidgeting with clothing. You can have taste, smells can be seizures. Lots of things can be seizures. What causes them? For some reason, there's this electrical discharge that goes off inappropriately. Somebody says deep nuts. April Davis, hi. Kathy Cruz, lots of crying while laughing. April Davis, how are y'all? Greetings from San Antonio, Texas. Why is cancer? Cancer and Petite Malin. She's talking about the little type of seizures, little seizures, partial seizures. BooBoo Kitty, you have to do this in a live chat again. Petty Mall from Petra Rosenberg. Gwen Vaughn, your dance moves looked like a seizure tonight. He's talking to me there. Purple. So it's like a misfire. Yes, that is correct.
What?
Oh, I got done with the comments, so I've seen what you got.
Oh, we're coming up with our final question.
They're coming up with the final question. It's like Final Jeopardy for you guys. Again, I apologize for Lisa showing the picture. I will do my best to edit that out. Okay. Need to do this more often. April Davis, really, seriously, you think that'd be good for this channel for me to do this more often? Okay.
We have a question.
Lisa, let me get through this real quick. Lisa Barnett, hi from North Georgia, which is the state just north of Georgia. Also referred to as Baugh, South Carolina. Petra Rosenberg, haha, Dr. G. Cheryl McNutt, lol, Dr. G. Lindsay Antoine, shout out to April from Texas, using the word y'all representing the southern gals. Video it, or it didn't happen, Dr. Gawain. Yeah, Dr. Gawain. I think somebody did have video, though. Bailey Girl Smith, greetings from Arizona. It's 114 degrees here. April Davis, yes. Cool Boy Gaming 10,
Hey,
okay.
If we were in Arizona, it'd be even hotter.
Okay, Jenny Locker, OMG, Sharon. Or did you already do it?
I did it.
Did you do it?
I did it.
Oh, I feel foolish. Sharon Calvert, should be an interesting summer, lol. Mary Frances, everyone donate $2 to Super Chat. The info alone is worth it. I love you, Mary Frances. April Davis,
No,
hey there.
you better love my mom, not Mary Frances.
Oh my goodness. Jenny Locker, Johnny, where is she? She's so embarrassed she's not even upstairs. Joni Finlayson, Dab. Bailey Girl Smith, lol. Dr. McKiska, Dr. Dab. Cool Gaming. Can you dab for me? Jenny Locker. OMG, Claire and Barney God. Is it true that the brain does not completely mature until the age of 28? Actually, it does much earlier than that for girls. A little earlier for boys. Plus 10, Lisa. Nice move, Dr. Vaughn. April Davis, y'all are just too funny. Okay, I'm ready. Did you guys have...
Can you give us an example of how to use this?
Oh no! Lisa!
How in the
What's
world
the
did you get that?
question?
Where did you get that?
When you cleaned out the old office.
And you've been keeping it all this time. Did I tell you what it was?
You want to get in a live example?
On you?
Yeah.
Lisa, that wasn't the question.
This is the question.
Oh no!
Lindsay Antoine says speculum. It's kind of like a speculum. Huh.
Or we could do
This-
a live pimple popper on one of us.
This,
Yeah.
we'll
I have,
save that for another one.
I have a kit.
We'll do another one.
You have a kid?
Okay, Lisa found this. It's just
I have 3
simple.
of them.
You have 3 of them.
Yeah. You're gonna throw them
Normal
out.
people can only use 1. Okay, just plastic, and we do use these in primary care. I totally lost track of the comments, but I think somebody knew what it was there. Dr. Gwaine just says, wow. So Mary Frances says anal rectal probe. That's not what we call it, Mary. BooBoo Kitty, and suddenly Dr. Vaughan gets red and quiet. Lol, Mary Frances. Okay, so this is the trocar, I believe you call it. Not a surgeon, so I don't work with trocars a lot, so don't give me a hard time for not knowing the exact term for it. But the device is called an anoscope, meaning something that allows you to look in an anus. So let's do it like this. There. Who's in the scope there?
Katie.
So it's inserted in the anus. It's tapered, which makes it easier to get in there. Oh, that's what the trocar is for, is to make it easier to push through. Use lubricant with it, something like KY jelly or generic version we use for it. And it allows you to, when you get it in place, you can pull it back and you can look, and you're looking inside at the inner walls of somebody's rectum. And what you can find are hemorrhoids. You can find internal hemorrhoids and actually band them to make them go away, which helps to get rid of bleeding sometimes if people have a problem with rectal bleeding. So apparently, it's, just plastic, really cheap things. Lisa was at the office when we were moving from one building to another, so she found it.
I thought it would be a good white elephant gift, so I took a bunch.
Excellent, make excellent white elephant gifts. Dr. Gwaine says rectum. I don't even know him. All right, let's get back to.
Okay,
April
the girls
Davis.
might have to peace out.
Oh, okay. All right, go ahead.
Bye.
Oh.
Lisa's out.
You're taking all your
Do
friends.
it one by one.
Okay, say your name.
Hi, Katie.
Bye, Dana.
Bye.
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 Grace. Okay, thank you, ladies.
No.
Okay. Block Cool Boy. Please block Cool Boy. Who's Cool Boy? Oh, yeah, he wants me to dab. No, I'm not going to block him. At least not yet. But thank you, Billy got one. Well, and Billy got 126. I saw you on Carlo Aller's channel doing comments on some of his videos. I was there too. Lindsay Antwine, we used trocars in embalming. Awesome tool. Oh, Lindsay. Yes, I forgot that you knew about that. Dr. McKeska? Hope it's clean. Yes, we do. T-Lung, oh dear. April Davis, Yucko. That purple, I see. Bailey Girl Smith, no thanks. Cool Boy Gaming still wants somebody to dab. Hallie Spencer, guys, help King Robux get to 400 sub, please. BooBoo Kitty, wrecked him, you killed him. Nice, Dr. V. Cheryl McNutt, I've seen it all. And Claire and Barney God, the shower brings back memories. My daughters, I'm sorry, you guys can't even see half of my face there. Bye, ladies. Cool Boy, not cool. Shh. Yes, I agree. I've actually had one of them in me. Oh, I'm so sorry, Petra. Cool Boy, please stop. Bye, girls. Cool Boy, dab, dab, dab. Okay, yeah, I'll finally put him in timeout. It kind of looks like he doesn't know when to stop. Okay. All right, I think that's enough, Cool Boy. Yeah, we know. This was nice to do again. Lost your face. I'm sorry. I keep looking at the girls and talking to them, and sorry about that. Or showing you the device. You're great at Thank you, Bailey Girl Smith. April Davis. Bye, y'all. It's late here in the Alamo country. Stars are big and bright. Good night. Yes, good night. And Alamo, we know it didn't actually have the Taco Bell top on it back when it was actually the Alamo. We were taught that. TR, watch recently Dr. Gwaine handle a mouth abscess. Man, I've been there. I felt that man's pain, but having children kind of made that mild. BML, later guy, love your channel. Signing out from Pakistan. Peace. Gwaine, while we're doing shout outs, check out my blog on Monday. Yes, well, okay. Dr. Gwaine's blog on Monday is not funny. No. not entertaining, but informative for summer. So get ready for summer by checking out the drgreenknight.com blog. Thank you, Dr. Vaughan. What time is it, Auburn now? I actually don't have a clock, so I can't tell you. It's somewhere between 9 and 11, I think. Mary Frances, did you enjoy camping, Doc? We didn't go camping. Sharon Calvert, night, the purple formaldehyde better than Botox? That's a question for Lindsay Antwine. Lindsay Antwine, I read the blog every week. Dr. Green Knight, Cheryl McNutt, love the blogs, Dr. G. And good night from Houston. Dr. Gwaine, I really like your blog from BooBoo. Rosemary Weeks, your face is, I'm sorry, it's lighting. So thank you so much for participating. I will try to take out Lisa's pictures for the afterward. Of course, it doesn't matter for you guys because you suffered through it in real time. Dr. Gwaine saying thanks. Mary Frances, the last live show you did, okay, it's 6:51 a.m. in Sweden. Formaldehyde is a carcinogen. Stay away from it unless you're dead. And the purple, okay, so thank you.